Hello, and let's talk about Shaheen Bagh. The anti-CAA protesters who have been on the Shaheen Bagh site since December 15th were evicted by the police on Tuesday morning. This took place following the imposition of Section 144 in Delhi in the light of the coronavirus pandemic. Protesters were also reportedly evicted from the Jamia, Hosrani and Seelampur sites according to media reports. Cranes were brought and many of the temporary structures were taken down. The protesters had last week planned a reduced sit-in after taking the necessary precautions. The Shaheen Bagh protests are a key moment in the history of independent India. For over 3 months, it was a space that offered hope to many and a challenge to the government's bid to push the CAA, NRC and NPR. To discuss its past and its future, we have with us Pranjal. Pranjal, thank you for joining us. So, in some senses, it was inevitable that this would happen considering the rapid spread of the disease, the imposition of Section 144, the calls for nationwide lockdown. But nonetheless, the fact remains that Shaheen Bagh's contribution to the anti-CAA movement is very integral. Possibly it was, you can maybe even call it the heart of the anti-CAA protests across the country.
Right. So you're absolutely right in that sense, because if you look at different other sites that had come across in different parts of the country, so they were, apart from being known as, say, Ghantaghar protest of Lucknow, they were also known as Shaheen Bagh protest of Lucknow.
Right.
So Shaheen Bagh that way was a symbol of resistance against this entire CA, NRC and NPR that was there. The other thing that we also need to keep in mind that this was a protest which was one of the first, actually, if I'm not wrong, was the first sit-in site protest that started in the country against CA, NRC and NPR.
Right.
And it was a spontaneous protest, not led by any of the either political organizations or civil society organizations that way.
Yeah.
People came together, they assembled at one place, and then they started this entire narrative.
Right.
There was no one person leading the protest. There were voices of the movements, but you can't say that there was one person who was leading the entire protest. So it has that way set up many examples of how a peaceful protest can be carried out and how a long-term resistance can be carried out against such government policies. So you could see there people coming up in large numbers every day. Everybody was doing different kinds of work. There was a library there. There was basically there was an open library there. And then on special occasions, for example, the New Year's Eve, the Republic Day, different kinds of program took place. Different artists came and performed there. So that kind of variety was visible in Shaheen Bagh. I don't think I have seen any such thing in last many years that I've been following different movements.
Right. And this is despite the number of provocations, the
Right.
individual gunmen,
Yeah, that
the
we always
government,
need to keep in mind, because also, you must see that during the Delhi elections, the entire focus somehow was Shaheen Bagh, not roads, not schools, not hospitals. BJP's entire election campaign was pitched around what Shaheen Bagh people were doing and how it is causing problem for different sets of people, which it was not, as it has been said, that the other side of the roads were blocked by the police, not by the protesters. And protesters gave way to ambulances, school buses and all. So that was there. And despite this continuous provocation that a gun was hurled there, firing took place few days ago, petrol bomb was thrown there, despite that protest carried on without any problems.
Right.
So that's why it's a very significant it would be a very significant event in the history of different protests that have taken place against NRCCA and NPR.
Right. So the key question now is, although this seems to have been pushed into the back burner because of the coronavirus crisis, nonetheless, it still remains a question before all of us as far as to how the resistance can continue. And one of the things with Shaheen Bagh was that it was a living, symbol of the protest.
Right.
So,
for example, once this entire coronavirus threat started and the government brought Delhi under lockdown, you could see that they had placed tents and basically small mattresses like 1 meter apart, and one person was sitting there. So that protest had, as you had already pointed out, that protest was anyway going on. The important point obviously is what will happen to the resistance against CA, NRC and NPR. As we can see in what happened in Ghantaghar, Lucknow, when they withdrew protests yesterday, they made it amply clear that once situation normalizes, we'll come back and do the protest.
Right.
I think that is what is going to happen in Shaheen Bagh also, because despite various threats, it continued. I think it will continue. Right. Obviously, when the country is facing a severe crisis in terms of coronavirus, so But there are other issues which we must not forget. CA, NRC, and NPR, who it is going to affect. It's going to affect, as we've already discussed, not just one sections of the society based on religious lines, but also the poor and the marginalized will get affected.
Exactly.
And the same poor and marginalized is still getting affected when it comes to coronavirus
Precisely.
crisis. The government hasn't done anything for them, right? So those are the people. They are still there in. They're on streets. They are living on streets. They don't have food to eat. There's complete lockdown. Is anybody talking about them? No. You must see that Shaheen Bagh continuously not just raised issue of CA and RC and NPR, but it was also talking about these issues. It talked about employment promises that the government had made. When it came to Kashmiri Pandits, they talked about them as well. They expressed solidarity on every festival. People from all communities came together and sat there. So those are the things which were very clearly visible in Shaheen Bagh.
Right.
We won't be able to say it, but does that end? I mean, they would be in a better position to answer.
So we are looking probably that once things settle down, the possibility.
Obviously, this is not going to stop. They had made it amply clear from the beginning. Whatever happens, even when there was continuous threat of different rumors were being spread that the protest side will be evicted on this and this date, various BJP leaders made provocative statements from in an election rally, and they said we'll get it cleared. Various fringe groups also tried and they tried to disrupt that entire thing, but it didn't stop. I don't think this is going to stop even once the situation normalizes. People will come back there. They'll be the beacon of the protest that they have been for last many months.
Thank you so much, Pranjal. In our next story, we move to the COVID-19 situation in India. The number of cases is close to 500, and as more states go for various degrees of lockdown, certain questions remain. A key question is whether we have actually done the required number of testing. And this is something we hope that Prime Minister Modi might talk about today evening when he addresses the country. Do we actually know how many people have the coronavirus infection in the country? To understand this, we talked to Dr. Yogesh Jain of the Jan Swasthya Sahyog in Chhattisgarh. Here is what he had to say. Thank you so much, Dr. Yogesh, for joining us.
Yeah, I'm happy to be here.
So I'll start with the issue of testing. So one of the key questions that journalists, health experts have been asking from the very beginning this news emerged was whether India is doing enough tests. And when we look at the numbers are not completely available in the first place. And even when we look at the numbers, we find that there are huge variations. States like Kerala have done relatively larger number of tests, whereas there are a number of states which have done very, very few. And the question from the very beginning has been that whether the low number of tests probably is concealing the actual spread of the disease and the seriousness of the situation. So you've written a bit about this. So could you tell us what you think on the situation right now?
So it's clear that the testing criteria as a way to decide whom to diagnose and to diagnose well enough has been flawed and seems to suggest that there is an attempt not to know the exact truth about the burden of the problem that we have in the country. So while in the garb of certain assumptions that the problem has not really been percolated into the community, has not spread into the community, we chose a very stringent criteria for the first several weeks of this pandemic in India. In fact, as late as till 2 days ago, this has been that we are not we have been only investigating and offering the tests for the COVID-19 to only those who had come from abroad and were symptomatic with fever and cough, or if there was a health worker or a family member who was in contact with a lab-proven COVID positive person. Now, with this restricted criteria, obviously the number that we picked up as problems were very few, in spite of the fact that there were several of us who were found to have been infected within the country. And we had been asking for evidence of, the lack of community transmission, as it is called, that is transmission happening within the country, where the experts who decide this testing criteria would say that in their limited search on the samples that they collected from some random patients, they did not find evidence of COVID-19 in their body secretions, and thus they said the lack of evidence was evidence that there was no community transmission, and thus there was no need to test them. I think in this limited criteria, in this making such a stringent criteria, there were some things also operating, such as whether the number of test kits that the country had at their disposal were fewer than what they needed. And secondly, they used the bogey of not creating a panic situation of a lot of people going for the test. But I think in the process we missed out a few weeks. I would say at least 2 weeks in picking up the problem in adequate numbers. Because without picking up someone who's got COVID-19 positive, even if we don't have any treatment for it, we would have been able to isolate, quarantine people who would be infected, preventing the disease from spreading to other people by appropriately isolating and offering treatment to those who would be able to get out with non very high level treatment also, like giving oxygen and other things that would have been possible. So we are learning it the hard way now, and only as late as 2 days ago, the ICMR, which is the government body entrusted with deciding on the testing criteria, has added a few more criteria for investigating, so that now they also offer it for those with severe pneumonias who are coming to the public hospitals. Plus, they've also now allowing it for symptomatic healthcare workers. Even if they don't have a contact with a COVID positive person, they're offering this test. But still the numbers have to pick up. As late as yesterday, there were only 18,000 tests done for the entire country, of which close to 500 samples are positive.
Right. So the key question, like you mentioned here, is also the issue of test kits. So when we're talking about the lack of enough test kits, is it a supply issue, or is it that, could you talk a bit about what exactly is the problem there?
So I think they needed to, for performing this test, which is a nucleic acid detection test, PCR, polymerase chain reaction based test. You need machines that can do the PCR, which we have in plenty. So the country has more than 100 institutions which can do this test on at least about 100 tests a day, without even going into full steam. But you also need probes and reagents to do this this testing of this specific genome of this virus, and that has to be procured from various places. I know for one that the NIV Pune, which is the nodal center in the country to do the confirmation test, have developed their own test kits. And even till yesterday, there were 18 candidate tests clamoring for validation so that they could be offered to a much larger network of diagnostic labs, of which 2 have been confirmed to be validated yesterday. And at the same time, not only this offers now, but even before this 2 extra tests were validated, the country had enough numbers. I am told at least 100,000 kits they had, which could have been, they could have ramped up their diagnostic process. So compared to countries like Germany and South Korea and Singapore, and now increasingly, not as a good example, but United States is also doing such a large number of tests now, and yet we are with one of the lowest rates per million of tests being done. So in any case, the thing that we're running is that we are missing out on some people who have the disease and are not picked up, and thus we are allowed the epidemic to progress, where we could have picked it up earlier and sort of restricted the total number of secondary infections that would have happened.
Right. So what you're also saying is that community transmission is probably well underway in India already.
Absolutely. I have no doubts that community transmission is there. Even if the latest data from the last few days suggests that for close to 15 to 20% of patients, the most data sets say that they don't even know where the person got infected from. And whenever such a question is asked in press conferences, the people who decide say that they don't want to share, personal data in this case, which is actually, one is not asking for personal data, one is asking for the mechanism where those people could have got infected in the first place, which is actually in the larger interest of the entire pandemic management that we need to understand. But that even that information is denied to the people who are asking for that bit. Yes.
Right. And the other key question here is regarding the personal protection equipment for health workers who are in the front lines of, say, dealing with this pandemic. Now, we had this huge celebration, so-called celebration on Sunday to honor their work. But many media reports as well as testimonies from health workers themselves have pointed out that there seems to be, in many hospitals at least, and many centers, a shortage of such equipment, especially if you're looking at the possibility of a major inflow of patients.
Absolutely. So I think there is a personal protection equipment, which includes masks, gowns, gloves, and those hazmat suits. They are and sanitizers have been in short supply because of lack of information for the community, and thus overuse and misuse and hoarding done by the people at large.
Right.
And thus, not only this, even though the country had, the government had more than 3 weeks lead time after the cases in late February were found out, they did not put manufacturers in place. In fact, there has been some major goof up. Yeah.
Yogesh, could you start with that after despite the fact that the government had 3 weeks because there was a break in between?
Yeah. All right. So in spite of the government having a lead time of close to 3 weeks from the end of February, when they made a strategic plan to procure this personal protection equipment in large numbers to plan for the control of the epidemic, they did not set in place their procurement policies and practices in the right place. And even a couple of days ago, we have know that from good media reports and from direct interviews with the the manufacturers associations of these personal protection equipment, that they would not be able to provide adequate numbers of these things even over the next few weeks. And we are already in a crisis. There is a shortage all over of all the equipment, personal protection equipment, and which is going to worsen into a really an emergency in the next few days. There is little doubt that would happen. And in the middle of this, they come up with an advisory that they issued yesterday of offering a drug like hydroxychloroquine for health workers who are going to be exposed to those who are suspected or confirmed COVID positive. In a sense, making, sort of trying to assuage the health workers who were not taken in by those thalis and the talis, that even if they don't have those masks and gowns, they would be having a drug to protect them. So we know clearly that this drug is not going to replace the personal protection equipment value. And if at all, even if they look at the data, there is no data for preventive value of this hydroxychloroquine being available through any studies. It is only a stretch of imagination from one study of its use in treatment of some people in France, that they are extrapolating it to use for prevention of COVID infection, and in the process being unscientific as well as practicing poor public health management of a pandemic like this, where you are killing a drug which might be potentially useful for further use in treatment of people who become very sick, but also at the same time allowing the public with poor information and leading to a shortage and stockpiling of this drug, which would thus make it only available for a few people in the country rather than everyone who would need it.
So one of the key areas of your work has also been on community health, and that also involves looking at the socio-economic aspect of health itself. So as far as the government is concerned right now, what would you suggest are the key priority items on this front? When we're talking about livelihoods, we're talking about the economic impact, the number of daily wage laborers in India, for instance. So keeping all these things in mind, in addition to, say, ramping up testing, in addition to providing or trying to procure as much as personal protection equipment as possible, on this front, what does the government need to do?
So I would clearly say that we need two major interventions that should be there. First, we need to protect people's health not just from COVID infections, but also from all the other things for which people access the public health systems. So I don't want someone to die of tuberculosis because the person did not get his TB drugs in time and yet saved from COVID infection. So I would want all the public health programs that look at people's management of illnesses where time sensitively you require drugs to be continued, whether it is tuberculosis, diabetes, HIV, leprosy, cancer, and so many other illnesses. I don't want the public health system to close its outpatients and chronic disease management strategies at the community and clinic levels to be crunched by our efforts to control this pandemic that we are still not doing very well at. The second, which is far more important, is the way we are using some strategies like lockdown. In this case, locking up an entire community is called a lockdown. I don't know why it is not called a lockup of the community. Doing it in an inhuman way, killing the social and the economic lives of people, where when we know that majority of us are still in an informal economy situation, to not protect people through adequate provision of food and their other needs is something that is completely unacceptable, to make people die of of illnesses due to which are happen due to hunger or due to lack of money for other things, but save them from COVID infection. So even in the way this lockdown has been organized, suddenly stopping all means of transport has led to a large movement of people from cities where they had migrated to their rural areas in where they come from, whether it's Jharkhand, Chhattisgarh, Rajasthan, coming back from Gujarat, Maharashtra, and other bigger towns. In a sense, also not getting leaving in haste, and but also probably possibly getting the virus along with them and spreading it to the community where they're finally reaching, and in the process also completely without any protection for their livelihoods and their lives in a sense. So learning from the way Kerala has done, and maybe some other countries have been doing, which have higher social security systems, better security systems, we need to go on a war footing to prevent our people from dying due to other reasons and their lives being destroyed for all times to come. While we are trying to prevent this pandemic from killing people due to in the short and the long run. And we need to see this pandemic we need to have a humanistic lockdown rather than an inhuman lockdown that we have been having.
Right.
And even prisoners in a lockup have certain rights which we need to protect. As at the moment, if we are all prisoners of the state at the moment, people need to be protected by providing adequate food, healthcare, and all the other rights that are still valid when you're locked up.
And finally, there's also the question of scientific temper, because we saw how on Sunday people gathered across the country. In many places, it almost descended into a procession or a celebration. And before that, there were all these WhatsApp messages. There's been a lot of fake news going around regarding how coronavirus can basically disappear in 12 hours, or that clapping or sounds made basically kill the virus. And a lot of this is done by supposedly educated middle class people as well. So there's also the larger question of a social crisis we are facing in terms of scientific temper when as far as dealing with coronavirus is concerned.
Yeah, so we are reaping the harvest of lack of scientific temper, or I would say distemper in a sense of in the country. And added to this, the lack of transparency and secrecy about information, adds misery to the misinformation that goes around. If you don't tell people what are the symptoms, and you don't test people when they want to test it, get themselves tested, and don't provide the right information at the right time, then people will obviously imagine things about causes and treatments of problems that they face, and attribute it to through racial slurs, or through destroying the poultry industry that has happened now, where swine flu was probably confused with coronavirus infection. And thus people culled, thousands and lakhs of poultry in most of central India, destroying the livelihoods of a large number of people, plus also, endangering people's nutrition levels. This has been, this makes interesting yet macabre, observation, the way crises like these bring out the worst fault lines in our understanding of the world around, and the lack of science and the scientific temper that we have in our minds as we approach, and also the lack of social the social and the economic fault lines also come out very clearly. Most of the recommendations regarding social distancing sort of are targeted only at the middle class and the city folks, rather than about all the city folk and about the rural folk, where most of these advisories make no sense.
Right. Thank you so much, Dr. Yogesh, for talking to us.
All right.
That's all we have time for today. Keep watching NewsClick.